Okay, we will start with an invocation from Felicity Penner, known as the Professor.
Don't even go there, okay? Behave yourself. God bless you all. I love to chant. I've been coughing. This is an allergy, but if I cough in the middle, I'm sure you will forgive me. And if you don't, I'll let Malcolm take care of it. Okay, joking aside, shall we? Oh God, make us holy, from which the pit of self has been blown, that we may become a clear channel through which thy love may flow unto others. We supplicate your presence. We supplicate your forgiveness and assistance in all that we're doing. God bless him.
Amen.
All right. Okay, guys, thank you for joining us tonight. We are the Human Relations Council. We are committed to engaging in activities that nurture harmonious relations among increasing diverse community in Hemet-SJ-Menifee region of Southern California. Our mission is simple. It's to foster interracial respect and acceptance. And we do this by working to advocate, educate, and advise and create cooperative networks of like-minded groups and government agencies, all in the service of justice and equity for all of the members of our community. With that being said, I have a very distinguished gentleman online that is going to let us know about a project that is coming from RUHS Behavioral Health. It is my great honor and pleasure to welcome you all to tonight's meeting. We are fortunate to have with us Dr. Chang. He is a board-certified child and adolescent forensic psychiatrist who has been serving as the director of Riverside University Health System Behavioral Health since 2018. Dr. Chang has been a valuable member of the department since 2014, and he is deeply committed to integrating behavioral health services into primary care and increasing access to patient-centered services. Under his leadership, RHS Behavioral Health received $17 million crisis Care Mobile Unit grant from the Department of Health Care Services last year. The grant enabled the expansion of the mobile crisis management teams, providing crucial crisis response services to individuals with ongoing behavioral health care needs in Riverside County. Dr. Chang's impact is felt across RUHS, which comprises behavioral health, community health centers, public health, and medical center in Moreno Valley. RUHS serves over about 60,000 people annually with a full range of community prevention and behavioral health treatment services. And the system operates 79 clinics, including 3 mental health urgent care centers and 3 transitional age youth centers for youth or young adults aged 16 to 25. And so, ladies and gentlemen, please join me in welcoming our distinguished speaker for tonight's meeting, Dr. Matthew Chang. We are eager to learn from his invaluable experience and expertise as we continue our mission to promote mental health and well-being in our community. Dr. Chang.
Yeah, thank you. Thank you, Malcolm. And I definitely don't deserve that, but I will take it. I appreciate it very much, and just very kind words from you, sir. And thank you for having me. I am in a bit of a mild panic, only because we were working everything and everything was good, and then I managed to delete something I think I needed. So I am going to keep talking while I do this, because apparently I'm not technologically able enough here. But I do want to thank you for having us and for having me. We do want to talk with you all about a wellness village in it's the Hemet Wellness Village here. And I'm happy to take questions as we go along. But I will start there. I'm so sorry. Here we go. Let me try this one more time. I promise. I was practicing this thing earlier and it was working totally fine. And now, of course, I need to do it. It's decided to not go.
I've been teaching online since 2004. I'm still in trouble, so you're doing very well.
I appreciate that, ma'am. I'm like, wait, what's happening? Give me 1 second here, and let's try this again. Okay, download that here. And I do, while we're doing this, I want to note a couple things. We do have members from our team here. I know Robert Youssef is here, Melissa Noon. I believe I saw Marcus Cannon as well, and I think some other folks maybe on from our department. Sandy Idle, superstar Sandy Idle, I know she was on, and others as well. And
I'm here. I'm here too, Dr. Chang.
Deborah's here. Deborah's here to keep me straight, and that's what we always need. But no, I especially appreciate them because I can't make the thing work. All right, here we go. Let's try this. Can you guys see this okay? Can you guys see my screen?
Yes,
Okay, all right, very good.
there you go.
I will try to stop panicking then. So we're talking about the wellness village, and so what is a wellness village? So at its core, a wellness village is a campus. It's a campus that has the full array of behavioral health services, the full array of substance services, the full array of physical health services, as well as the complement of housing and placement options. But on top of this, and interwoven into this, is the focus on an ethos of social determinants of health. As we've gone through the pandemic together, we've learned a lot from our friends at RUHS Public Health, and one of them has been about social determinants of health. And this is the notion that your zip code matters more than your genetic code, and seemingly disparate things such as tree canopy and green space can have a real outsized impact on your health and well-being. And so this is a different presentation. I can go into some different areas of focus we've had, but we've taken all of our learnings, our focus on mobile teams, mobile crisis teams, the focus on integrative services, including with substance services, obviously, but also physical health services, the ability to focus on right care, right time, right place, to bring more intensive services to those folks who need it. And on top of that, overlay a focus on social determinants of health. So this village has a focus, for example, on educational services and vocational services, things that we feel are very important to help our consumers move towards wellness and towards recovery. One thing I want to point out is that recently, in the last maybe 4 to 6 weeks, Governor Newsom has come out and talked about the need to modernize the provision of mental health, behavioral health services in California. And there's a lot to unpack there, and it's a lot of moving pieces. But one thing which I think really resonates or aligns well with this conversation is he's talking about building out, on one hand, focusing on intensive outpatient services, which we call full service partnership programs, to focus on that modality of care, as well as building out regional campuses or campuses throughout the state that have a continuum of care. They're able to provide behavioral health services and substance services. We actually think we are ahead of the curve a bit there, at least we're hopeful, in that we have been focusing on this model. And again, the emphasis on physical health, and then on top of that, things that are, fulfill fulfill the soul in terms of educational training and vocational training, occupational training. So with that, the last thing I want to say, because I know, and Malcolm's alluded to this, and Malcolm, I hear you're having some tough times, and I'm sorry for that. The conversation, we've heard some questions about, well, why Hemet as a place to have one of these? And so I do want to point out that we're looking to build multiples of these throughout the county. Based on what the governor is talking about, they may maybe build multiples of things like this throughout the state. But back to the focus on social determinants of health, there's a tool which came out that we learned about again from our friends at Public Health, which is called the Healthy Places Index. And essentially, and I'm no expert, but my understanding is it looks at social determinants of health in a community. It actually looks by census tract. And then there's a score that's assigned there. And so, 50, an HPI of 50 would be right in the middle, right in the median, I believe. And so essentially we're looking these villages where areas we think there is high need. When we've looked at our own internal data before these conversations, we have seen Hemet as having a high need. When it comes to HPI, the census tract that we're looking at to build this wellness village actually has a score of, I believe it's 6.8. So it's low, and I think really speaks to the need in the community in that specific area. And the last thing I'll say is actually the lowest HPI score in the county is in the city of Hemet. It's a score of 2 point something. And so I think that really speaks to what we see as a high need for services such as these in the community. So I will hopefully get the computer to move here. Oh, we're doing well. Okay. So some of this I've said, but the Wellness Village provides health and wellness services tailored to the community. So it has primary health care, and I think I've said this before, but it's not just behavioral health, it's not just substance, it's not just housing, but it's dental, x-rays, mammograms, pharmacy, obviously the mental health and substance use disorder services, including urgent care service for adolescents and kids. And I think I talk about this later, but one thing I'll point out is that children's services, and for our definition, we have it as 12 and younger. There's actually no children's mental health urgent care beds throughout the entire county. And so this would be the first such children's mental health urgent care beds, which we're super excited about. It will be a state-of-the-art campus, and it will serve kids, families, veterans, other individuals, provides the community with new health services, parks, and ability to promote wellness for all. We feel, and we are working with folks to try to quantify this, but it'll generate a considerable amount of direct annual spending in the city of Hemet. It will attract hundreds of doctors, nurses, social service providers, and other healthcare professionals. And to that piece, this is in a later slide, but we're looking like it will generate at least 600 jobs. And I'm in the field, so I'm obviously biased, but it seems to be good jobs, jobs that help with education, jobs that provide a nice quality of life, jobs that we think are helpful for a community to have. And again, I will point out that we are working with, I believe it's UCR, to get a fuller economic impact picture. We're already here is one of the other pieces. We do have clinics in the Hemet and San Jacinto Valley area. In the past 6 months, we've seen about 1,500 people, and I want to thank Sandy, supervisor of the Hemet Clinic, and doing just amazing work. Substance abuse prevention and treatment, older adult services, and then the primary physical piece as well. And one thing I want to point out, and why I keep harping on this idea of integration, is we know that people with mental illness die on average 15 to 20 years younger than the general population. In Riverside County, it's actually much worse. And so this is several years old now, but when we looked, people with mental illness were actually dying at the average age of 42 years old. And they're dying of preventable causes, diabetes, hypertension, pulmonary disease. And oftentimes it's because they weren't accessing services, weren't able to access services, or, just were not accessing them. And so several years back, the department has undergone a bit of a transformation in that we really pursued behavioral health integration. And so in the newer physical health sites, we have now embedded behavioral health staff. And so we now provide psychiatry, therapy, and substance use disorder services throughout the county at all the RUHS, who are known as community health centers. And the idea is that is a one-stop shop for a consumer or a community member who needs to come in and get all of their healthcare needs addressed. And the really neat thing about this wellness village is that it takes that concept and I think expands upon it with some of these other parts that I'll talk about. And again, this speaks to that we're already providing services here. The CARES line, this is where folks can call in and get screened and sort of triaged or sent to the appropriate level of care through our system. We have navigation teams. It won't surprise you, but we have a pretty large system, and it's important for our consumers and their families to be able to get the right care that they need. And to do that, part of this is building our navigation team so we help navigate our system. Mobile crisis teams, these are an important part of our care continuum. These are folks who go out into the field and interact with an individual who might be experiencing a mental health crisis. We also have law enforcement ride-along teams where we'll put a behavioral health expert to ride along with either a police officer or a sheriff's deputy. We have outpatient clinics, which you see here. Just a shout out to Friday Night Live. This is a substance use disorder prevention program that is in a host of school districts throughout the county and in Hemet and San Jacinto Valley. So we're very proud of that. And then you see this work here that we're doing in schools. Malcolm, I'll keep going. One thing I wanted to, if I wasn't clear, if anyone has a question, please raise their hand and just shout out and ask. The other part, and as I'm talking, I realize I'm starting to ramble because we can go down any of these little tributaries and talk at length about all of them. But I'm going to try and be good and stick to the presentation and stick to what we have here. But please feel free to ask questions that we'll try to answer. So what will the village add to the community? The one thing I want to say here, and this is a very nice picture, but we've seen other renderings, and I think Malcolm has, and I think we can share. It'll be state of the art and just beautiful, beautiful buildings. And we've heard a concern in the past that behavioral health are these old, drab, scary buildings, and that's more of the olden days. The newer things that we're doing really have a very nice aesthetic. They fit very well in the communities where they're housed. One of our programs actually won a City Beautification Award several years ago. And this thing is nicer than that. I'm just going to say it's nicer than that. But we'll have urgent care services. You see the housing, right? So the patient and family, that's the other big component here. Family treatment housing, long-term behavioral health housing, and then kids and youth services and the community wellness and education. I think we've touched on this, but just to go over it again, all these different pieces in a one-stop shop for the community. So all your physical health care, dentistry, mammograms, x-rays, pharmacy, women's and children's, the WIC office, our kids and youth services, so outpatient services, family short-term residential, crisis residential, and then urgent behavioral health care. And I think I did mention this already, but just the piece about having kids mental health urgent care is critical. We view our system as a continuum of care, and it's absolutely necessary to have these different levels of care so we get folks into the right level of care that they require. And having this part local or on site will be huge, because right now my understanding is someone's having a crisis, and let's say they might need to go somewhere else, they got to drive them over to ETS, which is the psychiatric ER in the state of Riverside. That takes law enforcement a long time. They got to drive there, they got to stay with them for a bit, then they got to drive back. It takes folks off their regular duties. It's much harder. Whereas here, the idea is you have a continuum of care and you get folks through all of the services and their needs locally, which is wonderful. And I mentioned that, so yes, it has all those services I just talked about, behavioral health, substance, physical health, housing, but on top of that, it really is a community focus. So there's a community park, there are trails, there are rest areas, there are gardens, there's a village theater, there are sports courts, there's a market, there's a cafe, and I want to get back to the social determinants of health conversation. We recognize that the ability is supermarket access or market access is a critical part of health and well-being, and so we built it into this concept of a village. And then pet services. For a lot of our consumers, their pets are their family members, and so we've had consumers who will decline services or decline housing because their animal, their pet, can't come with them. And the idea here is with pet services is that there's an appropriate place for their pet, and so that the consumer, he or she, can go and get the appropriate services that they need as well. We also believe that there is alignment with what we understand to be the plans and goals, and to promote economic development that increases citizen access to quality jobs and shopping experiences while increasing the city's tax base. I'm not going to read aloud all of these, but I think there'll be a whole host of jobs. There'll be over 600 jobs. We intend to contract out the majority to what are known as community-based organizations or CBOs. We also believe these folks will reinvest in the community, having local purchasing preference when they're there and when they're working there. Bolster the economy, spending money on local-based businesses, hospitality services, education, food, retail, gas, and housing. We want to support the success of the community by maximizing our resources to provide the greatest possible benefit for the city of Hemet. I think this goes back to the issues we've seen in terms of need in the community showing up very high just on our own internal data and the way our own internal work, but also going to the Healthy Places Index, which is sort of it's not us saying it, it's a zoomed out view of the area and of the need, and again, it speaks out to a very high level of need in the area. And so we will build a whole bunch of resources and increase the community's social, emotional, and physical well-being. I already touched on the community parks, health centers, one-stop shop for the whole wellness of the area. All right, to manage the city's growth by protecting and preserving the environment and maximizing that use of public infrastructure. Again, this is, you had one sort of slide of the design, but it is absolutely beautiful. We are happy to share that with you. But the design includes respect the design language of the region and climate, and help shape the future of the city by building within the surrounding context and creating opportunities of reintegration and community engagement. I will, here pause and just shout out the team that has been working, night and day with folks to try and build out what this will look like, to build basically the most beautiful thing that we can, and something that all of us, all of you, all of everybody can be very, very proud of. To improve the quality of life by addressing the root causes of crime. So the village will address many of the root causes of crime and divert Hemet and Central Valley residents from jail and ER to a road of recovery and wellness. Let me talk about a little bit about what I mean about this. So when we look at our continuum of care, when we look at the crisis teams, the idea with the crisis teams are that they can intervene when someone is having a crisis and hopefully divert them from a community emergency room, a psychiatric emergency room, or a jail. And in some of the data, it's a different slide deck, and I apologize. But we have, I mentioned our full service partnerships, our most intensive aggressive services, outpatient services that we have. They decrease arrests by 80%. I can't remember if it's 82 or 84%. And so these are people who are coming through what's known as a forensic FSP program. So even qualify for this program, they're coming from jail, prison, or what's known as our AB 109 program. And so essentially, when we're wrapping these appropriate services around them, again, I want to shout out to Sandy and to the whole team at the Hemet clinic and all of our clinics. I mean, they do just amazing work. And when they wrap these services around these individuals and you put appropriate housing and placement, you take care of their physical health needs, they get arrested at a much, much, much lower clip because they have the appropriate support and structure in terms of what they're doing, and helps them along towards recovery. Okay, so this is an important one, I think, and we've heard a lot of this. So I want to point out what it's not. The Hemet Wellness Village is not a homeless shelter. It is not a psychiatric hospital with 5150 holds. For those who don't know, that just is the California Civil Commitment hold. That is for the psychiatric ER and psychiatric hospital in Riverside. There's also one in Indio as well. It's not a dumping ground. All of the programs that we've talked about have that idea of wraparound services and wrapping around the consumer and the staff to make sure that folks are doing well, that they're doing appropriately, that they're getting the right care that they need. It's not institutionalized design. This is more of a commentary around the psychiatric hospitals of the 70s and 80s, the state hospitals, the jails, those types of things. These are really beautiful buildings and community that will really, be very aesthetically pleasing as well. Not unsupervised and unsafe. This is a heavily supervised community, a heavily supervised campus with all these programs that we're running. Okay, so what will it do? Improve community health and wellness, create new jobs, we talked about already, be a desirable place to work, receive health care, and to build new life connections. It'll really increase community healthcare provider options in the area and the region, can generate a considerable amount of economic revenue, protect vulnerable youth, and support our veterans. That's something we're very interested and passionate about as well. Foster self-sufficiency and recovery and save lives. I'm going to pause. So this is a brief video that we have. This is also the part that I don't know if it's going to work. Luckily, Robert is on standby to do it if the audio doesn't come through. But I'm going to press play and see if this works here. It's a brief video, so I ask your indulgence here. Robert, I'm going to kick it over to you, sir. We figured this might not work. So Robert, please go ahead.
Okay, and then if Mary, if I could have the screen, I will play it.
I will
Okay, you can, yeah, you can have the screen. I've got it set up so you can take it.
Perfect. Okay.
Could you also send us the link to this, if you don't mind, the chat?
We will. You'll have it, Felicity.
Yes, in the chat, if you look, I've already put the chat. There's a Google Drive that has all of this wonderful information that Dr. Chang has provided tonight, including this video as well, too, to share. Okay.
I'm 0 for 2 on technology tonight. That's good to know. I apologize.
Can we see my screen?
Yes.
Okay. Can you hear it?
Yes.
When I first came here about 5 years ago, we saw a big increase starting with patients that were coming in with opioid addiction. And as you know, opioid addiction and opioid deaths have been rising significantly in the country, and no different here in Riverside County. So we saw a lot of women coming in, they're pregnant, they didn't know that there was any treatment available to them. So we actually didn't have one to begin with, and we just started it up because we saw a need.
The perinatal program is for any mother that is pregnant and is struggling with substances. For mothers that are pregnant and also have children, so that they can get the help that they need to change their entire life. Their kids deserve a healthy mom.
I found out about this program when I became pregnant with my third child. You know, this pregnancy was scary. I needed a doctor who knew a little bit about addiction and OB/GYN, so I was referred to one of the doctors here at RUHS. Having the stigma of being an addict, I was nervous, I was scared, I felt like everyone was going to be prejudiced and no one was going to give me the correct care I needed.
I was worried that people would tag me as a careless mother. I tried to go to every OB/GYN I could. All of them was the same. As soon as they saw my chart and everything, I wouldn't even get to see the doctor. They would honestly give me a look like judging. Made me feel very, very bad. The difference here is it was nothing like that at all.
I think that the big misconception about these women is that people think that just because they are addicted to a substance that they're not worth trying for. I don't believe that. I believe that everybody has issues. Their issue just happens to be substance use. And just because they do have that problem doesn't mean that they don't have the right to change and to be there for their children.
I kind of started sensing this pregnancy was a lot more than just being pregnant with a baby. I knew there was a lot of hope in this pregnancy.
What I loved about Dr. Cheryl is that he looked at me straight in the eyes and he said, there is hope. If you want it, we're here. It's not only me, it's a group of team that are willing at your disposal if you want it. We're not here to judge you. We're here to hear you out.
We really are a collaborative environment. We do not judge. We do not care what their backgrounds are. We just want to take care of them because, after all, what most women want is to have a healthy baby.
You know, I love what I do because I'm also a recovering addict. I have 17 years clean and sober. I was pregnant and I did use substances and I had no idea where to go. And that was 29 years ago. Since then, so much has changed. And if I can do it, if somebody like me can do it, anybody can do it. They just need to be shown how. My advice to anybody that thinks that they can't get help or there's no hope is that there is. Just get here.
While in the program, someone told me that one good decision springs off into a host of many good decisions. And coincidentally, today is the day I take my son home.
I wanted to give up, but because I didn't, I found this program. And I'm very grateful. Because if I did not, I don't think my son would be here today.
Thank you, Robert. Yeah, as you might imagine, we've seen that several times, but it always gets us always still impacts us. And you know, I think what I would say is that those are the types of services and programs that we're trying to bring in this village. It's not just substance care, it's not just behavioral health, it's not just physical health in sort of a siloed approach, but rather I think what you hear clearly is that integrated approach is what helps lead to those wonderful outcomes. And so that's just an example of one of our integrated services and what we're trying to do there. And like I said, thank you, Robert. And also, as he said, in the Google Drive, the information that was sent, you all can get that link also. Thank you. Okay, I think I'm thankfully for everybody basically at the end. This is just to say, you know, we have been meeting and talking with folks. This has been a kind of a long time coming in terms of the idea. We didn't get into tonight, and I won't, just the huge needs throughout Riverside County. Everywhere we look, there's need for behavioral health, substance, physical health care. And these villages, it's just interesting. It's sort of in alignment with what the governor is saying about the way he wants to take the state, but it's where we think the field is going. So again, I want to thank the team for all their incredibly hard work on this. We've actually drawn down for the Wellness Village concept $80 million in competitive grant funds. And it actually was the largest award for one of these rounds of competition, that concept of a wellness village. Because again, you know, I think the more we talk about, the more it makes sense, the more is what's important for a community. And we're hoping to bring it to Hemet. That's something that we're really proud of, and we're working on. One thing I want to just say before kind of hand it back over to you all is there's an ask. I believe that we are asking this council for a letter of support that we would send to the Board of Supervisors, and we can share with you what we're thinking, and you can tell us if it makes sense or not, if you're able to do that. But just to let the Board of Supervisors know, hey, you know, you all think this is an important project and of value. So with that, thank you very much for your time. I apologize for some of the technical stuff, but happy to take any questions here.
Thank you, Dr. Chang. I'm going to open it up for questions. Anyone have any questions for this group?
Yes, I have some comments here. I think this is an awesome program. I don't know when it's going to take effect, but it sounds like it's something that's definitely needed. Now, one of the things I didn't hear anything about is what kind of support do you have for the spouse or the parent of someone that's in this whole system? Is that even considered?
Yes, it is. And so we have, so a couple of things. One thing before I forget, and I'm going to ask Melissa to keep me honest, I believe we're supposed to start by the end of 2023, and the project would need to be completed by sometime in 2026. See, Melissa says I'm totally off.
Nope, that's correct.
We're still good. And then supporting the spouse and the family is certainly something that is very important. And so we do have support groups within the Department of Behavioral Health, something we call the Family Advocate Program, where basically family members learn how to advocate for their loved ones and to support one another. The other piece I was going to say, of course, now I've entirely lost it. Oh, we partner with organizations such as NAMI, and Brenda Scott in the city is a huge supporter, and we work very closely with her, and that's sort of that family support and that spousal support as well. I don't know, ma'am, if that answered your question sufficiently.
Yes, it does. And I was very involved in the NAMI program several years ago when I was living in the Phoenix area. And that was, for me, it was really a lifesaver. It was great. My husband was the patient. So I was there to support him, and NAMI was there to support me, but I think even more help would have been of great benefit to me.
Yeah, and the other thing I would point out in the actual campus itself, and then this is a big piece, right? So there are family apartment units and recovery residences and their caregiver spaces for, I'm going to the terminology, but respite care for family, and a lot of focus on that. And this is actually, you know, it's interesting. If you follow the arc of where we've come from, we've learned so much, we think, and try to get better in an iterative approach every day. But that focus on family housing units is something that we're trying to build out, because historically we've had, you know, single units and this or that, like, oh, what if they have a family? And so this is important for people's wellness and people's recovery. And I'm reading, I'm sorry, there's some chats here. Have there reached out to the neighborhoods in the area and done any outreach? You know, ma'am, I think if I can, that slide, which now I've closed, of course, it does have us having a lot. So a couple things. We've met with a bunch of folks and their dates in there, and I can pull up and we can all look, or you can look on the Google Drive. I do know that we are scheduled and scheduling, and actually I'm going to try and I'll look myself and just tell you. I know that, for example, we had things scheduled on McSweeney Farms. It looks like on April 26th. There's American Legion District 21 on May 24th. And I know that there are additional HOAs, I believe we're called POAs, meetings upcoming that we have to talk about the project.
All right. If anybody else has any questions, do the symbol for your hand so I can call on you. Let's go with Lisa. Is Lisa with her hand?
Yes, hi. I was wondering, are there any city council people here? Is there anyone here that is not for this? Or is this a meeting of people involved in the making of this? Are there any opposing people here that need to hear something more? Is the question wrong? Are there any scoffers here? Are there any city council members here that I'm a client? And I had prepared a statement, and my statement was toward the scoffers of this program. So I'm hearing the presentation, and I think it's an excellent presentation. I'm already 100% sold on it, of course, but I want to try to sell the scoffers on it. So I'm wondering, are there even any people in attendance that are not for this?
I did shoot out a mass email for all the people who are against it. I do sit on Hemet City Council as a vice mayor. And so I'm the only one really on the council that is supporting it right now. And what I need is the community to get behind it.
Yeah, because I have a great statement for the community. Whenever you're ready, like at another time, I have experience in having gone to rehab because of chemical dependency from med compliance. I've been homeless. I've done all the stuff that you guys are talking about here, except for no incarceration, other than temporary incarceration. But this is this is much needed. And I think that the community, like some of the pushback that I've been hearing from the community, like at my pool class, and like a lot of older adults, they're afraid of what's going to be brought here. But what they don't understand is that this is the answer to all of the problems that everybody has been complaining about for decades, and that this will clean things up. And so I'm ready to be the designated crazy person for you. If you want to hear my statement at another time, if there's opposing people, because this is really important. And mostly people don't.
Lisa, I'm gonna give you time at the end to read your statement, because this is recorded and it'll be on the website, so we could link it to everybody.
Okay. Yeah. Okay.
So I'm gonna give you a chance at the end, but I'm gonna move to.
Excellent.
I think Mary had her hand raised first. I'm gonna go with Mary first.
I did. I just wanted to say that Lisa's absolutely correct about the way that the city sees this. And I don't necessarily mean all of city council. I mean very many people in the city. This is a history in this city of not wanting outsiders in and not wanting to help people who are not from here. What they don't understand is that the people you're helping are from here. Yeah. They just don't understand that, because a lot of the people have their head in the sand because they say, well, you know, our families don't have drug addiction. Yeah, right. Our families don't have mental health issues. Yeah, right. They just really are not seeing reality. And this has been, I've been around the Valley for almost 50 years. And it has been this for a long time. This kind of attitude of don't let anybody come in here. I used to run the homeless shelter in town, Valley Restart Shelter. I ran it for 5 years, and I was accused of importing the homeless. What they didn't realize was that 98% of our people graduated from the high schools in the Valley.
Yeah,
And
they
I
don't
kept
want to,
trying to tell them, but they wouldn't believe it.
yeah.
So, yeah, anyway, I
our-
just want to let you know, this is not a new phenomenon. This is Hemet, and hopefully we can change it.
All right, next I'm going to call Marla. I'll come back to Marla. Let's go with Judy.
I was just wondering if you're getting pushback from the for-profit medical community and from the city, because with a nonprofit, they're not going to get property tax and income tax.
There was a statement brought up like that
Because
from one of our council members.
I think that's a definite problem. I personally think this valley is a stark violation, because if you do most of the practices, they're all held by one holding company. And I think that's why we haven't gotten a lot of help in here, because from what I've heard through the grapevine kind of thing is that was the pushback. They're not getting anything for it. All these nonprofits come in here and then they can't get tax money. They're so geared on income, which I can understand, but one hand washes the other. If you're healthy, you don't have a problem getting people in here.
Yes.
Well, if I could jump in, this is Robert Youssef. You know, the property that we're proposing this on is a county-owned parcel. So what you're seeing here is not something that we didn't buy a retail site or something that was zoned for retail, that would have had a shopping center. This piece of property is already owned by the county of Riverside. So we're not deterring or taking away from something that could have, potentially been there and generated sales tax revenue. The other thing I would let you know is the things that Dr. Chang mentioned within the amenities. You saw there was a market, a cafe, that's being proposed there. That's an opportunity for someone to come in and operate and run. And so again, people are going to come in, they're going to shop there. They're going to, get their coffee there. Again, it's in the other big pieces on the economic pieces, the folks that are working there, those doctors and social workers and peer support specialists, they're going to go out and they're going to spend their money. They're going to buy lunch, right? They're going to leave for lunch. They're going to go to the Hemet Deli. They're going to go to the downtown deli. They're going to go down to downtown Harvard Street and grab their lunch and come back. So there's a definite opportunity to generate local revenue there.
Thank you for that, Robert. Let's go with Marla next.
Okay, so as I said and listened, we all can point the finger and blame basically why the people is coming and why this isn't going to be a good project. But me personally, that has survived alcoholism and drug addiction, being homeless for over 12 years. People are thriving just for somebody to give them some type of hope, some type of understanding, just from a narrative, whether you ever been on anything in your life, just from the narrative of care. So who better to be able to run this facility? What better place for it to have? Because it lessens theft, it lessens carjacking, all the things that they continue to complain about, but yet they don't want to seek the help and allow the help to come into the city that's more than needed. There's people that love to help in places like this and would be more than happy to see something like this arise. How excited it would be just to see someone get sober, someone to get mental health, a baby being born healthy and clean after the mother is struggling with nowhere to go and has nothing to own but addiction. So to me, this particular project would be outstanding, especially in a city like that. Now, before it didn't welcome everyone, but unfortunately, they're dropped off here. So now we just need to figure out all together as a whole, whether people are opposed to it, give it a shot just to see how it works. That's the thing that is going to be the most challenging part. Is just getting the ones to see that's never been on anything or won't admit that they're addicts, but they are. is having the hope that we all have if we've ever suffered anything or lost someone to the loss of drugs and alcohol. So I think it's a wonderful thing. And I would love to volunteer and be one of the women to work there. I really will.
Thank you, Marla. Let's go with Eve next, followed by Mr. Phenomenal.
Hi, Malcolm. First of all, thank you for your support as being part of Hemet Council. I had a question for you. I understand that some of the council members were actually for it in the beginning. What happened to change the other people's minds?
How do I formulate this answer without name dropping?
No, it surprises me because it's such a, as you know, it's such a wonderful project, especially for the youth. There is nothing like that around. And it's something that we need desperately to be able to help and support people.
So imagine being somebody in a position able to make a decision, and then someone approaching you because you thought it was the best decision at the time, and then someone approached you and gave you a different alternative belief about it that was stronger than your belief about the project itself. That's pretty much what happened. And another thing that was confusing was that this started off with, they claim that it started off with a lower number of beds, and now the county is talking to us about adding. They believe that they've added, even though in the beginning they talked about the overall beds, but they're kind of saying it like the beds were going to be like it was just going to be a place where just like, I'll throw the number out there, like there's 400 beds, but they don't understand that there's different sections where you have 30 beds here, 20 beds here, 100 beds here, 90 beds over here. And then the totality adds up to that. And another thing they didn't consider was anytime we're talking about these types of projects, the projects go through amendments. We can see that through our assembly bills and our Senate bills. When they're created, they start off with this idea and then they get amended. And so I see they're not looking at this as being amended, and they're looking at it as the county is kind of sneaking things in, but they're not following the process of the amendments. That's how I'm interpreting it. And so it appears to be a threat. And so people are using words that produce fear in people, and that's how these the people are starting to change their minds about different things. And so that's pretty much my 2 cents about it. I hope that answers your question.
It does. My thing is, how are we going to change their minds to see what it actually is, and not what they perceive that it is, but the facts of what it actually is.
The only thing we could do is just keep having these meetings and talking about it. Yeah.
Thank you again for your support, Malcolm.
You're very welcome. All right. Now, Mr. Phenomenal.
What's going on, Mr. Malcolm? Greatly appreciate you throwing me in on the loop and allowing me to have a voice. A lot of people don't know that I have a lot of friends in the Valley, and you know, one of my friends, Dennis Fletcher, that was his big thing, was the homeless, the mental health. And I really believe that this program, that you guys are trying to put in place, I really believe it will be a key to saving a lot of the families that's suffering right now. I'm all for it. I'm all for it 100%. And whatever it is I can do to help get the word out, to get people more involved, just let me know. However you need me to spread the word on this project. Whoever you need me to get in contact with, I'm gonna do my part to make sure that we can get it in play, get everything rolling to the best of my ability. I'm here to help, and me personally, me being a person that deals with mental health issues, and I'm not a substance abuse user, but just knowing that I have mental health issues, I really feel like this would be a really good asset, because a lot of the people that are out there on the streets, they're not suffering from drug addiction or anything like that. They just fell on hard times and it mentally broke them. So I just wanted to give my 2 cents on that. Let you know I appreciate you. I got your back to the best of my ability. And thank you for being who you are and doing what you're doing.
Thank you. He doesn't know yet, but he's going to be our next board member, Mary. Maria.
Hello, good evening. My name is Maria Marta Moreno, and I have lived in the Hemet-San Jacinto area for 18 years. I moved from San Diego. I am I want to mention this as well, not because it's important, but because I want the community to know that a serious mental health diagnosis can come to anybody. And I am a single mom. I experienced domestic abuse in my marriage for almost 20 years. I had 3 kids. Unfortunately, after that divorce, and feeling that I was free from that chaos, my children started to experience a serious mental health issue. Hello, can you hear me?
Yes.
Okay, perfect.
Yes.
And one of my sons was diagnosed with schizophrenia. So living in Hemet San Jacinto Valley, it's basically in the middle of nowhere. It's a beautiful valley. I love it. That's why I moved here. But we don't have good services. We don't have great services, mental health services here in the valley, and we need them here. We need to help a lot of people, especially after the pandemic. This has gotten worse for youth and for families. So it is a great benefit to be able to live that, to support this project, to come together and support this project, because we need more of this. We need this service here in Hemet. Thank you.
Thank you so much. I'm going to put my email in the chat. So if anybody, all those people who are talking about they wanted to get involved, what I'm going to do is I want you to email me so I know you want to get involved. And then what I'm going to do is I'm going to shoot you a link to this video that you could send out to everybody. Trying to type and talk at the same time. That you could shoot out to everyone to share this information. You know, if it's a church, just let me know what you guys have. I don't know if you could get like a lot of people together, 50 to 100 people together, even the people who are against it in one space. I believe I can set up something where the county could do something over Zoom again, or even come out to us and do some more outreach so that everybody's kind of abreast to what's going on. Does that make sense? For the sake of time, I'm going to go ahead and end it here, but I really appreciate everybody's attendance. Just take in what you've learned today and just think about it. Think about the people that you know who could learn from the information and understand it, and just next door, Facebook, Instagram, and share the information about there, so it kind of gets out there. Okay, I want to express my heartfelt gratitude to Dr. Matthew Chang and his team for sharing his time, his expertise with us. His presentation was insightful. The information and the strategies that were discussed today I know will serve as a valuable resource for all of us here in the city and just here in the Valley, the San Jacinto Valley. And I'd like to thank all of you who attended and participated in tonight's meeting. I appreciate your engagement and dedication to mental health and the betterment of our community. Those things are vital to me. And so as we move forward, let's continue to collaborate share our resources and develop innovative. You guys can even share your contacts if you're up to that in the chat, as we develop innovative or more innovative solutions to support mental health and the homeless and all of the diverse needs in our community. But before we adjourn, please remember to check our website, humanrelationscouncil.com, I believe.
Yes.
Very easy Google search for updates and upcoming events and opportunities to get involved with the Human Relations Council. If you do want to get involved in the Human Relations Council, there's a link on the website for you to contact us. We look forward to seeing you guys at our next meeting, where we'll continue to explore new ways to enhance the lives of those we serve. Thank you again, Dr. Chang, and to everyone here tonight. Have a safe journey home if you're somewhere and you have to drive, or have a safe journey logging off. And let's keep working together to build a healthier environment.
Malcolm, if I could just chime in, I just want to say thank you for giving Dr. Chang and this team an opportunity to tell you about this wonderful project. You know, I put at the beginning of this chat, and I will include it again, there is a Google Drive that has everything that you saw here today. It's got a fact sheet for you. It's got a little bit more of the data that advocates for a project like this, but also more importantly, it has what we need from hopefully this council and in the individuals here is a letter of support. So in that Google Drive, you'll see a letter of support that's directed to our board of supervisors. And so if you feel the need and you're passionate about a project like this, like we all are, we just ask that you would consider downloading that link, downloading that template. You can put your name and address on there, and we can get that over to the board of supervisors. I'll also put my email in the chat. So if you need assistance with that, or direction, I can assist you with that as well too. So that's what we're hoping, is that also that this wonderful council will consider a letter of support, and the individuals here will consider a letter of support as well.
Can you send it again, Robert, real quick? Someone has said.
Absolutely. So I'm going to give you my email address. I'll be more than happy to assist anyone that needs help with that process. That is in the chat now. And let me go ahead and give the Google Drive that has all the wonderful information that Dr. Chang showed tonight.
And Malcolm, I will put, when I put the recording of this meeting on the website, I will also put the Google Drive information so people can have access to that.
And forgive me, Robert, I forgot about that letter that everyone could individually send. That's another resource, because when you download it, you can also pass it on to your friends to send it as well.
Can I just say something? Dr. Chang and the wonderful co-workers that you have here, I am at awe. Because I'm a teacher. I work for Southwestern College, and we need these kind of projects. Our students are suffering as well, and we are dealing with a lot. So God bless you. And honestly, you should have charged Malcolm for your presentation. I'm just saying.
I can't, because other people put it together and they're much smarter and better than I am. So I just
I don't believe you.
I'm driving the car tonight, but thank you. And thank you, Malcolm. Thank you for having us. And thank you everyone for your time and attention. We very much appreciate it. So thanks.
All right. With that, I bid you all a farewell. Good night, everyone.
Good night, everybody.
God bless.